It's my great pleasure to introduce Marta Arguello, who is going to be moderating our response panel. Our plan is to have about 20 minutes to hear the suggestions from the air, soil, and water groups, and then to hear the response of our panelists. So I'm going to turn it over to Marta.
Good afternoon, everyone. So I'm going to talk really briefly. So it's very exciting to be here. Is this our 7th year? This is our 8th year of doing this conference. And it has been the place that has helped seed and grow the kind of partnerships that we want to see between the environmental justice community, the public health community, and the women's health community. And so some of the things that have come out of this is that we were able, with a lot of your support, to get bisphenol A out of baby bottles. There's been lots of victories in between, but just a few days ago at the end of session, we were able to win a bill. A lot of that those collaborations born here around disclosure of chemicals that are used in cleaning products, and groups like EDEPSCA and Change and others that have always been at these conferences help make that happen. So what we do here matters, and the connections that we make here matter. And what we really wanted to do this afternoon is hear from each of our workshops. There's some folks who work within the policy realms to be able to react to how we start moving some of this work. And we did air, water, and soil, and we know that those issues are interconnected. So this is a chance for us to talk about where the intersections are, how we can advance this work, and how we can move upstream to create solutions that protect women's health, so that we're addressing some of the health disparities that we heard about this morning. So I'm going to stop talking, and I hadn't thought about an order. So, air, A, yes. So A first, air. Where's our air person? Oh, you're first, Nancy. So I'll keep talking while Nancy pulls herself together. This is teamwork. So again, I'm just really happy to see so many of you here. We hope you stay engaged, and that you get involved in a lot of the policy things. Before I forget, because I will, if you are a health professional, a licensed health professional, there's a letter out there that we are encouraging you to sign to support a health and safety buffer zone around existing oil wells. We want to make sure that there's a strong voice from health professionals saying we need to stop this practice that's harming our patients. So with that, here's Nancy.
Thank you. I don't usually respond to being called air quality, but perhaps I should. Greetings again. We just finished a very detailed conversation on the air quality tip, and it's a little difficult to narrow us down to only 3, but I think what came out very, very strongly and passionately is a very strong appetite to get to action over words, and that communities have moving legislation, moving policy, and prioritizing communities that are impacted by, particularly cumulatively, by the complex impacts that are experienced. So action, communication. We need to do a better job of communicating what the impacts really are. There is this, we need to educate folks that just because you don't see a brown scrim every time you wake up in the morning doesn't mean the air is necessarily cleaner or less hazardous to your health. So we really need to do the messaging, and of course the burden is, as always, on community folks to be able to articulate that with our researchers in exactly the right way that makes the compelling case against the legions of industry scientists. We recognize that the zero emission technology exists. We need to put our action toward a goal of zero emission, keeping fossil fuels away from the incredible harm that they do within our communities, that technology exists, and we need to maintain a very clear, long vision to make that happen. and to get on the same page about it and not talk about interim or incentivized strategies unless they really move us very decisively toward a zero emission goal. Trish, do you want to add anything since you're on this end too that I'm missing?
No, I think you've done a nice job of summarizing.
Okay, thank you. And thanks to the air quality panel.
All right, so our next workshop will be the workshop that addressed soil contamination. Am I doing? Okay, sorry. Not always paying attention. So we're going to talk about air quality for about 15 minutes, and then we're going to have the soil presentation, and then we'll talk about soil for 15 minutes, and then water. Got it right this time. I apologize. All right, so go for it, Angelo.
Okay. I'm happy to start. Angelo Bellomo, Department of Public Health. Cindy Harding, who was here this morning and addressed the group, I thought did a very good job of explaining what our organization does, so I'll sort of leave it at that. Just in responding to the suggestions that were just made by Nancy, I think the one comment that I would make is that it's a complex matter, and we really can't tell without monitoring and without effective monitoring whether the air we're breathing is healthy. It's not like in the old days where you could look outside and say, boy, it's smoggy today. Toxics is a very important part. Toxics is a very important part of what we're trying to control in the way of exposures today. Cumulative exposures, as Nancy referenced, is where we need to be focusing. And lastly, we really do need to expand monitoring, not only of the chemicals we have been looking at, but we need to expand monitoring for the broad range of chemicals that we haven't been looking at. So I think that's essential, and that's what I got mostly from the comment.
Yeah.
Okay.
You can do it popcorn style.
Oh, or is that how you want to do, or just write down? Doesn't matter.
Martha, what would you?
Go down the line.
All right,
Since
the executive decision. Okay. And I'm Linda Blount with the Black Women's Health Imperative. Nancy, I think I kind of feel your pain, because it's great to say, communities need to be at the forefront, which is absolutely the case, but then there is that burden on community members to translate what's important to them, to researchers, to policymakers, in a way they can understand it and act on it. And of course, you all know that community members often get pushback. We can't say it that way, or that's not how we do things. You all know that drill. So from, kind of an advocacy perspective, we have to make that case that the voice that matters is the voice of the impacted community, and it's not this situation where we get into, our oppression is worse than yours or our impact is worse than yours. But policymakers and researchers have to understand and listen to what community members are saying. And what we offer to the folks we work with is try to make, I hate to put it this way, but try to make the business case. There are issues, and this is going to be true for all report outs. It impacts our community, and so sometimes people say, well, you should care just because, it's the right thing to do. But honestly, unless you can kind of tie it to an economic impact as well as the health impact, it's hard to get people's attention. And so the important thing is to come up with that kind of language, that community members can use to speak to these stakeholders in a way that they can actually do something with it. But also, obviously, they have to understand the broader issues. But at the end of the day, it's the community voice that matters.
Ooh, that's heavy. Hi, everyone. My name is Gisele Fong with the California Endowment, and I'm actually speaking about this issue from a funder's perspective, but also from the last 10 years when I ran my own environmental justice organization around freight transportation. So I just wanted to kind of echo and affirm what some of the things that Nancy were saying, that when we're supporting this work and when we're understanding this work around environmental justice and air quality, that it really has to begin and end with community action, right? Community-based solutions. And just sort of piggybacking off of what you were saying in terms of narrative change, I think we live in communities where so much of the burden of environmental justice is so normalized, right? I mean, I live in Long Beach, have raised my children in Long Beach, and the kind of the burden of so much pollution, cumulative pollution, is very, very normalized. And so it takes really a huge narrative shift to be able to put faces around this. What is the human impact? What is the human impact on our developing children? And, you know, the kind of the burden that communities are faced with. And just to put this into another perspective, the reason why this needs support from funders, from policymakers, from all of the above, is that there is so much power that is invested in big industry, right? I mean, so this I'm sure will come up in many of the report outs when we talk about refineries, when we talk about the ports, we talk about freight, or we talk about oil drilling. This is big money, right? And so when you're talking about community voices that go up against Saro, or they go up against BP, or the trucking industry, that is why there is an imbalance in power, and that's why it needs to get funded, to put the money into community organizing, to put the money into community based monitoring and research, and also communications.
Good afternoon. So my name is Trish Koman, and I'm from the University of Michigan School of Public Health, so I have sort of the research hat on. I would agree with a lot of what has been said, and I think our thoughts about trying to address the really basic social determinants of health, structural issues, is really important work. And I think being here in Los Angeles makes me remember that we are making good progress. And so that gives me hope that we can continue to make good progress, that these are solvable issues, although they sometimes feel a little bit insurmountable. As our air pollution issues, though, switch over to thinking about climate change, so it could be the air pollution of wildland smoke that impact communities, et cetera, our notion of what is community is going to need to also change. So who is in the tent is also going to be evolving. And I think that new partnerships will naturally form as that happens. And I think it'll be an exciting opportunity to see how that moves forward.
Hi, everyone. Good to see so many old friends and many new ones here as well. My name is Michele Prichard, and I'm with the Liberty Hill Foundation, where we've been trying and working hard to advance justice and equality across a wide range of issues for the last 40 years through grant making, through training, and also through trying to promote and build alliances and coalitions. So just to expand, I think, on all the other panelists here in the work group, on the concept of community at the center and in the forefront of all this work, I just wanted to say that some of the efforts that we've seen across the region have had a couple of key factors and abilities to do that. And so first, starting from research itself and data collection, there's a very primary role for the community there. The practice of community-based participatory research has been very crucial to both the Clean Up, Green Up campaign, which has set forth some new land use standards in the city of Los Angeles and some pilot communities that are environmental justice communities. But that couldn't have been done without the engagement of community residents who were really able to help expand the base of data. So that's one way in which community can be very involved. Secondly, developing the policy solutions themselves. Again, pointing to that example of Clean Up, Green Up, where Communities for a Better Environment, Pacoima Beautiful, Unión de Vecinos, and the Coalition for a Safe Environment, I think almost all of whom are in the House today, all were very active in thinking about the problem of cumulative environmental health exposure and what were some of the solutions that could be proposed. So out of that process came very concrete recommendations that came out of the experience of the residents. So for example, creating buffer zones between auto body shops and homes and schools, providing for much better enclosures of industrial facilities and so forth. Moving on, community engagement in the messaging is really critical. Empowering, training, and helping build the confidence of community residents to really be the messengers and the face of the various policy campaigns and legislation that we're trying to move towards action around. And lastly, I guess I would just say there's an important role for the funding community here, and that is just recognizing the role of community-based organizations and residents in helping to move this work. So, yeah.
Great. Hi, everybody. Good afternoon. I'm Saro. I'm with Senator Ricardo Lara. I'm based in the Long Beach District Office, and I really just want to confirm what many of my, I want to say peers and colleagues here are sharing around just making sure that the voices of those impacted are heard and really making sure that the stories are shared with the elected officials' office. And since many of us can't just go up to Sacramento, I really encourage you to contact your local elected district office. I can say that I'm always happy to meet with anyone who reaches out to our office to discuss any issue, ideas, solution, because it's more than just one conversation. It's many conversations. It's many brainstorming sessions, and that's our job. That's how I see our job is that we are our boss's eyes and ear, and making sure that we share this also with our legislative colleagues in the Capitol office. So I really want to reiterate and cannot stress enough that please reach out to your district office staff. They really should hear from you, especially when we have, and our district it covers along the 710 freeway all the way to unincorporated LA, Vernon, all the way to Long Beach. So we have one of the most polluted district in the area, and we've had residents call our office and say, you know, we've just been smelling a lot of really strong stuff in our city, and we don't know what to do. And so that's our job, is like we contact our various colleagues, stakeholder, and we troubleshoot and make sure that, you know, when you're working with members or constituents, just keep encouraging them. Well, they called and I called them and they didn't call back. We'll say, well, call again. Maybe we're trying to figure out, well, who's actually accountable for this? Who else do we need to get involved? The council member of your city, the mayor, what other companies are around that might be contributing to this? So we're sometimes in the midst of figuring this out, so there's a delay, but sometimes people get really discouraged, and I'm sharing this because people are always saying, well, they don't get back to me. Well, make sure that you all encourage each other. Well, call them back again, and call them back again, or call us again. So that's what I want to share. Just want to confirm that we want to hear from you. So please share your stories with us, and I want to relay that's what the senator always says when he meets with constituents.
Hello, everyone. Thank you for having me. My name is Angelica Hernandez, and I'm Senator Ed Hernandez's Health and Environmental Deputy. Just to reiterate what my colleague said, it's very true. We want to hear from you. A lot of people sometimes don't realize that our offices are very aware of maybe some of the issues that are ongoing in the fields or throughout our district, but we each cover about 1 million people. So we rarely hear from everyone. We hear from people, you know, maybe after the fact, after a bill was already passed. So we definitely want to make sure that you guys know that you have access to us. Don't get discouraged if you're not 100% sure how to reach out to us. Just pick up the phone, call, and one of our staff members would be happy to reach out back to you.
Sorry, I want to also add that we also try as much as we can to proactively meet with organizations, constituents. So we're not just kind of sitting waiting for people to call us. I want to make sure we share that we also go out and we try to be at every event we can possibly be at, or meetings.
Yes.
I just wanted to add one thing while we're on air, because I think a lot of what we're talking about will be equally applicable across the media. But just one thing with regard to air, and that is that we have to keep in mind that the way in which the current paradigm for determining whether an exposure is a problem is by comparing what's being measured in the air against a standard. And that is not always appropriate. And the reason I say that is that many of our standards are outdated. And even if a company is complying with a standard, if you've got 10 or more of these companies located in close proximity to a neighborhood, it's not enough. So the current standards are really a threshold. So when you do contact individuals, fight back if you get they're in compliance with the standard. If it's a problem, if it's making people in the community ill, it's a problem, and we may need to strengthen our standards.
So what you've heard today is sort of a slice of what air quality policy looks like, right? We regulate it at the regional level through the Air Quality Management District, and at the state level and at the federal level. So right now, we have very little protection at the federal level. So the work that the community groups that are in this room that are working on air quality is really critical. And a partnership with those of you. So how many of you work for an environmental or environmental justice organization? Raise your hand. Okay, how many of you really need the public health community to show up and help you with whether it's a district meeting or Sacramento? Come on, guys. Right, so we have an opportunity for real partnership because we need to hear those public health voices for all the reasons that you heard today, from being able to make the business case around the green zones to actually fight for the innovation so that we can say yes to things, right? What are the clean technologies we can say yes to? And then the other part is really making a commitment from the public health community. Look at what we did with tobacco. We made it unacceptable. We're taxing it to a pack of cigarettes is almost $10. We're making it inaccessible. We were getting younger kids. We had a real culture change. And it was the first time that the public health community actually did a campaign that directly impacted the power of a corporation to control the narrative, which is not unlike what we have now, right? The biggest impediment to all of the things that we're doing is the power of the oil industry to maintain their practices, to control how things are regulated. So we're asking the public health community to step into the role that they have taken for centuries, from when we attacked cholera as a waterborne disease before we knew why. It's that same kind of courage that John Snow, I don't have my PowerPoint, the other John Snow, took, that we're asking you to partner with the communities who are whose health is being sacrificed, that we can figure out a just transition, right? And so that way we have plenty of times when there is the real need for a nurse or a doctor or a health educator, because we rock, in a district meeting to be able to talk to Senator Lara, to Senator Hernandez, who, because 10 years ago, those of us who were doing environmental justice work, we were alone. We did not have partners in Sacramento, like the kinds of champions that we have now. And so we need to be able to take advantage of that opportunity because more people are needed. We did not win great wins around air quality and climate justice this last legislative session. And more of your voices are needed to actually be able to do this. So we need more funders at the table. We need to grow the table. But the fight for clean air is incredibly important. And like Angelo said, this issue of air toxics is going to be really important because there's stuff there's stuff happening that nobody's measuring. And just because they're not measuring doesn't mean it's not affecting our health. And so we hope you continue to work with us, sign up at the tables, contact us if you want a training, if you want to get engaged. From communities to a better environment, Esperanza Community Housing. I'm going to leave up for groups, right? IDEPSCA, these are all our partners, and we want you to be with us. So thanks. I think I might have talked too much, but so now we're going to do soil because that's an S, and I know my alphabet. So our soil facilitator is coming up. She will introduce herself. This is what happens when you're in ED and you do too many things. Like, hopefully I show up, remember where I am.
Thanks, Martha. So, yes, so we had a very rich discussion talking about soil contamination and lead abatement. A lot of ideas generated, so I'm going to do my best in kind of putting this into 3 broad areas. So, as you can imagine, a good portion of the discussion focused on the Exide cleanup. What still needs to happen, what didn't work, what hasn't worked. And so the recommendation that the group came up with, though, is to use what we've learned from Exide to develop a model for addressing future soil contamination issues with a focus on community engagement involvement, which has already been discussed a bit here, and really having a multidisciplinary approach, which incorporates a lot of different partners from a variety of settings. And so that in the future, when there's another issue like this that comes up, that we can do a better job of addressing it. So that was the first area. The second area had to do with data. So we wanted to make sure that we generate and incorporate environment, health, and social impact data into regulatory decision-making and decisions on resource distribution. So this is really using a data-driven approach to where and how much resources are being used and allocated, and how the decision-making is being made. And so part of this is also timely data. So making sure that we're able to get the data that we need to then make the decisions to have it impact in a way that meets the needs of the community. Some of the discussion was also around these robust cumulative assessments, which I think were mentioned as well. So we're not just looking at one issue, but looking at kind of what is happening at the community level as a whole. The third area was to really have a concerted move to focus on prevention. So to have a proactive approach to lead exposure prevention. So whether that means convening a group that can develop some sort of approach or a strong upstream approach, so that we're looking at preventing lead exposure versus then trying to address it once it's already happened, when there's already there's irreversible changes that have already occurred within our community members. So yeah, so those were our 3 big areas. Thank you.
Great. So there's a lot there, and I want to focus some of our thoughts on one, figuring out how to get data to be more timely, if you can sort of think about those issues. Also, this CI assessment and how we strengthen that and address even some attacks on our ability to collect community impact data. And lastly, how do we come together to do more this upstream work? If you guys could sort of riff on those things.
Let me just first start by saying that the Exide matter, there's plenty of lessons there. So let me just give my icing on the cake that's been said here so far very quickly, and that is that it's really about engaging with the community. And I'm speaking really as a health department, because the community has been engaged on Exide for decades. And who's really been slow to the party is the regulatory and governmental service agencies. So this is more not about engaging the community, but engaging with them and providing the community the information that will allow them, it's data, as has been said, providing them with information that will allow them to advocate for a change in conditions within their community, to effectively advocate for that. That's what our role should be on this. And then the other thing is that we really have to assign greater urgency to addressing these problems when they're brought to our attention. Exide is a classic example of failed policy where there's plenty of blame to go around. All agencies involved, even if they're not a regulatory agency, should have been quicker to jump on this one. And I think having that urgency, public health urgency, is something we've really got to make sure we apply. That's a lesson learned on Exide.
Okay. There's so much here. So, I like the idea of coming up with models. In one sense, sort of, if you've seen one disaster, you've seen one disaster. So it might be tough, but there are things we can learn. And actually what came to mind was what's happening now with the aftermath of the hurricane and cleaning up. And we've got another one happening now. There may be some learnings that can be applied there. I think about what happens to low-income communities, marginalized communities when these things happen. They never get factored into a model, and certainly not from a prevention perspective at all. But one of the things that kind of the connections that I was making, Rita, with what you said is, and it ties to data. So there's the epidemiologic data, there's the assessment data, but what we've found at BWHI is really important to listen to now is social media data, because Black women in our case, but people are talking about what they think and feel and believe about health and the environment and whatever is happening. Marketers tapped into that, obviously, to sell us products. But I think the public health community and the broader justice community could also tap into that as we've started doing that and listening and using that information to connect with influencers, because you need people who can speak for you. And I'll be honest, sometimes shame is really effective when it comes to policymakers, to put the issues out. And because it travels so quickly and you can have photos and video, it's easy to see exactly what's happening and you can't really deny it. So to the point, also then propose the solution. So not just complain. We talk to our women and say, say what's happening and then say what should be done and provide evidence. And so I think we have an opportunity to use social media. And I guess the final thing I'll end with is, I think community groups also need to be aware of what's happening at the federal level. I was thinking about the EPA is slashing budgets. That may impact what happens, that may impact response to issues. And so it's really important that community groups work with researchers and state policymakers here, but stay abreast of what's happening at the federal level in case there's some potentially for some adverse impact on their efforts.
Okay, so I wanted to go back to some of the things we were talking about around air. So I think that the key to working on upstream is exactly what we're talking about, of using prevention at the core, right? So that we obviously need to spend more time there to work upstream, whether that is public health folks, whether that's the funding community, whether that is our policymakers, and then also our community organizations themselves, really to kind of make sure that we're standing in that ground. And then I think the second thing that I will say is that Exide is a perfect example of this, that when we are talking about environmental justice issues, environmental justice travesties like Exide, that we're talking about racism, we're talking about equity. The California Endowment, one of our guiding lights is health and justice for all, right? So what does that mean? That means that some people don't have the same amount of health and justice. And where that cuts deeply into our communities is all of the, is around race, right? And I mean, this is probably not new to so many people in here, but let's just call it out, that when you're talking about environmental justice communities, these are low income and communities of color. And so the response to that, the upstream response, is that we need to use also an equity lens there as well. We need to put the resources, we need to put the organizing, we need to put the attention on those folks that are, those communities that are hit first and worst, right? So again, I would say when we're working on upstream issues, it is about prevention, right? And it's also using that race and equity lens and doing whatever we can to address environmental racism.
I actually want to thank you for mentioning that. We've seen many studies talk about the fact that your zip code can be a precursor in not only life longevity, but health issues. Our Senate district makes up the bulk of the San Gabriel Valley. Half of our district is 60% Latino in some cities. Half of our other district in the cities are predominantly API. We actually are home to Quimetco, which is a smaller version of Exide. And last year, our office was very engaged in the initial outreach to the community that had been affected by this facility. Quemeco is actually a lead battery recycling plant, and a lot of the issues that came from that was not only was the air polluted, but the soil was polluted. We saw that there is an increase in potential for children living within that 1 mile radius to have lead in their blood system. So our office has continuously been working with DTSC, with the Clean Air Coalition of North Whittier and Avocado Heights, who are residents who have been deeply impacted by this. And it's very accurate that growing up in communities of color or that live closer to industrial areas, freeways, we're going to see an increase in having toxins not only in the soil but in the air. And I'm sure we'll discuss water later because that also affects a lot of our health outcomes.
I think that the frame of cumulative risk is a really important and powerful one. So I'm glad to hear so much on this. I wanted to touch on the data aspect, and I want to agree that we need to not only be gathering data locally, but also keeping our eye on what's going on at the federal level. So, for example, the CDC has very important data doing biomonitoring of people and their bodies so that we can understand what chemicals and metabolites are present in our bodies. And those sorts of studies are long-lived studies, difficult to do, require a lot of community willingness to participate, and of course, funding. So I think that there's a role in the wake sometimes of the tragedies that we experience to take that moment when there's more universal agreement about the needs for action and prevention to try to also use that opportunity to advocate for some of these longer-term building blocks that are so important. The second point that I would make about some of the things going on at the federal level, for example, we know that lead is a potent neurotoxin. What you may not realize is that there's companies who are usually trying to get different additives that would be just as damaging to our health and would be aerosolized if we were to put them in our fuel system. And that's going on pretty routinely because it has a technology benefit and fuel economy benefit. But the health impact is really important. And there's probably 2 people at EPA whose job it is to turn them away. And I think they're both eligible for retirement. And so as you hear about big cuts in these agencies, it may not be that the level of cut matters, but the expertise and the ability to defend and prevent is so important. And we need to be cognizant of all of these various systems that are in place and protect us now and are working.
Well, ditto to all of the above. And I wanted to focus in on the prevention piece again and raise the issue of land use planning and the built environment. How many urban planners do we have in the room here? Any? Oh my. Okay, well, this is a problem. So anyway, really, Los Angeles, the whole region, is a case study in bad land use planning. Why is it that we have densely populated multifamily housing units that are right next to operating oil wells? How is it that we have, again, many, family homes and apartments that are right in the middle of goods movement corridors? We're seeing more and more about the health impacts of living near by freeways, yet we continue to build thousands of units of housing right adjacent. And ditto for Quemeco and Exide. Again, how is it that we ended up having neighborhoods that were allowed to have these kinds of facilities planted right there? So prevention means, taking a look at land use very long term. That is something that is really the jurisdiction of local governments and municipalities. And we actually have a new opportunity as a result of some legislation that was passed just last year, SB 1000. I forget the author, but it requires that all cities and counties that have general plans where they kind of map out where transportation, housing, industry, these big items, how do they exist in relationship to each other, all of those general plans will now have to include environmental justice considerations. So it's a great opportunity. It's kind of wonky. It's kind of in the weeds, but I would encourage everyone here to take a look at that and see if it's a new tool in our toolbox.
I really want to touch again on, I heard upstream a lot and around prevention, and I want to share, Senator Lara's lens in approaching legislation is really a lot about equity. It's how do we equalize the playing field for communities that really just don't have a lot of resource accessibility. And I want to share that allocating funds to doing prevention work is something that we always talk about in our office, that we make sure it's allocated in a certain amount to certain fields that sometimes are not always funded, which is human resources, education portion. And the other is making sure, how do we think about short-term and long-term legislations that can prevent and address these issues, not just on the community side, but the company side as well, or business side. But I'll leave it at that.
So I know we have a minute, but I do want to, I want to actually challenge some of the folks here for us to continue the conversation after the conference, because we think that there are some concrete ways that we can start looking at communities, figuring out what are the industries that are there, what are the tools that we actually need to, we have these green zone policies that are actually very forward thinking, but what we lack is the actual things to say yes to, right? From going from dry cleaning to wet cleaning, which is a safer technology, right? So what are those technologies? What are the opportunities for our communities to actually be the entrepreneurs that bring these new clean things? And also there's this concept of a caring economy, right? So we would love to follow up with Senator Lara and Senator Hernandez and some of the advocates that are in the room to talk about some of these ideas and some of the work that we're doing to actually work and partner with industry about how do they become good neighbors, but also what can they do to clean up their effluent stream, which is their mess that they leave afterwards. So again, we hope we continue these conversations. They're wicked problems. If you don't do them right, if you don't put equity at the center, you can sometimes make things worse, right? So we know that they're complex. So I want to thank the panel for helping us think through some of the soil stuff. And I certainly want to make a commitment to try to keep this particular part of the conversation going with some ideas that have been percolating out of communities. How much time do we have? We're out of time, right?
Water.
I know we have to do water. I mean, this feels really fast, and I want to be. I'm not okay. So next up, we'll be talking about water, that magical thing that we all need for life, but we don't know where it comes from. We often don't know how to protect it. So I got to be part of that workshop, and it was really exciting. So come on up and tell us what your priorities were.
Oh my goodness. Well, to she who works in water, hearing the term upstream kind of makes me smile. Water is an upstream business. And certainly very personal for the Council for Watershed Health, being founded by Dorothy Green, who saw problems in the Santa Monica Bay and immediately turned her head and looked upstream, because she knew that those problems were not beginning in the Bay, but they were beginning up in Tujunga and Pacoima and in South LA and in Long Beach. So instinctually she knew where to look. And so I think it's just great that when we're talking about the kind of strategies that we need to employ across the fields here in soil and air, that we're using the terminology of thinking upstream. So with that, yeah, we had a lot of feedback. Started out a little slow because water is a big topic, and so we tried to put that in context of how that impacts women's health from a watershed perspective, where we get our drinking water, who provides it, where does it come from, to a recreational scale, rivers, streams, beaches, that exposure to water impacts our health as well. And then down to the neighborhood scale, where we have issues of flooding, storm drains not working, which is a timely issue for LA County Public Health right now. With West Nile, there's a lot of fear and lack of information out in the communities about that. And so you have any one of those is a workshop in and of itself, any one of those areas. So we came up with maybe more than one per area. On policy, the obvious kind of hit us between the eyes right at the beginning of the discussion, and that was the lack of women in leadership making water management decisions. I can tell you, as someone who works with scientists and engineers from every water agency in LA County across the board, it is an embarrassment. And I stand here today, one who works in collaboration and in partnership with these agencies, but we know when women are in leadership positions, things change. When women lead, we all win. And we need to do a better job. But then we got down to the brass tacks of how, as a policy matter, what do we do as individuals, as working at universities, as an ED of a nonprofit, what can we do? So we talked about internships, the power of the work, the heavy lifting of equity in these positions begins with education, so getting women into these jobs. And through many fields. It doesn't have to be just engineering or environmental science, but it can be through public health. It can be through community organizing. So we talked about making that a policy priority, certainly holding our elected officials accountable to broadening that, to opening that table up for more women in those decision-making positions. And then the other one that we discussed at length was the issue, again, I believe you brought it up, that we're talking about climate change and these extreme events, whether it's Harvey, whether how many shook a little bit the other night with our earthquake, right? These extreme events don't discriminate, but their impacts do. And they impact communities with overbuilt environments that are largely paved disproportionately than everyone else. But we quickly pivoted from that reality to what water can do. And that was where there is really more need for education and understanding, because water in conjunction with these other issues can be an opportunity to change that built environment. Many of us in LA County are hearing the term resiliency more often with respect to water and water planning and engineering. And if we're engineering resiliency, that means we are greening the community. We are building and we're engineering to extremes so that we're prepared for drought with green infrastructure and we're prepared for flooding with the monsoons, right? So that was something that we talked about, where there is an opportunity for water to really help us achieve our health objectives. In the area of research, the lack of timely data was brought up as a priority, and needing to advocate for more funding with our government partners for their ability to put that information out and have it in a timely fashion so that it can be utilized effectively for advocacy and policy change. And that's coming straight from UCLA and certainly from my group, that there's no shortage of regulation in water. None. We've got tons of agencies and we've got all kinds of data out there, but where it is, when it's released, how it's translated, how it's languaged to the community is the big gaping hole. And so oftentimes we're very concerned about advocating for ourselves, which is awesome, always about more funding, but sometimes it's actually helping our government partners out, saying, no, actually we need the State Water Resources Control Board to have more staff so that their data is up and we're not looking at, Felicia, what was it, 2010 data to make decisions about where we are right now. So being a partner in getting that data out. And then certainly, to echo what has been said already, the use of community participatory data or ground truthing in water research. And this couldn't be more evident in the work that we do on environmental report cards or water quality report cards. Certainly our organization, when we were out in the San Gabriels, we utilized community members to do surveys regarding trash, because there are certain things that toxicity just doesn't measure. We actually need the community members to say, this is how many people were out here, this is where the bathrooms are, this is where the trash is coming from, and here's an effective way to educate people about changing behavior. So participatory research and ground truthing, very important in water as well. And then finally on advocacy, it's the wild, wild west on water. What was clear at the beginning of the discussion, because we did, all right, how many of you know who provides your drinking water? Oh, come on. All right. Well, if you live in the city of Los Angeles, DWP. If you live outside of the city of Los Angeles, WRD. Okay, it's a mixed bag. And we were talking a little bit about, if you go on LA County's website and you start looking at these water purveyors, you get up 50, 60, 70, 80 private companies. If you don't know who is providing your water, how can you hold them accountable? All right, so it's about educating ourselves and doing a much better job of educating ourselves. Water has been remiss at having this conversation with the community. I want to specifically emphasize a point that Martha brought up, was that there is a need for more strategic partnerships in advocacy. If we're going to be effective in sharing information about the importance of infrastructure investment for 100-year-old pipes, for multi-benefit projects in your communities, why water investments are being made in certain places, we must reach out and establish strategic partnerships with public health and others. And we've done this in a very practical way at my organization, mentoring a health-based organization in El Monte, day one, saying, you know what, we got to get out of the traditional zone of just talking to ourselves and the people that know our field, and teach others how to fish. No, the bad pun, water pun there. But really it was about helping them understand the power of water projects, giving them the technical skills to advance these projects in their own community. And as a result of that partnership, South El Monte now has a dedicated Green Street from a Coastal Conservancy grant in one of the areas of the county that has the highest childhood obesity rates in the county. So strategic partnerships matter, and we need to lead, because you're going to hear water agencies talking about partnerships within themselves, like these organizations, the County Public Works and LADWP and the City of Burbank and Glendale. They need to have more strategic partnerships. Let's lead. Let's show them how that's done. So strategic partnerships was a priority for us in advocacy. Thank you.
So if we could talk about this, so what does it look like to move upstream in terms of water, both from wherever you're standing, whether it's a public agency, a funder, a staffer within a legislative office, but also what we can be doing collectively to foster these partnerships, and how do we both partner with an agency that in some cases we may have to hold accountable and push. If folks can talk a little bit about those issues, or whatever else you want. But
I think it's important to start from the standpoint, and it sort of follows to what you had just reported. People have to understand the importance of water. Nothing is more basic to maintaining good health than water, both from a drinking water standpoint, water quality and adequate supply, to a sanitation aspect, because we can't really maintain proper sanitation without water. So nothing's more basic. Just a quick caution. There's going to be a lot of money spent on water development. I think everybody understands, our legislators understand the importance of water, and there will be major investments because it's a very fragile commodity here in our region. I'm really worried that at the federal level, they're talking about a major infrastructure program. And I'm worried that the water projects that they're talking about are water projects that will keep large consulting and construction companies very busy for many years, when at the same time we have small water systems throughout the country that aren't surviving. They're not providing clean, wholesome water and adequate water to the communities that they serve. And those will get left behind if there's not a concerted effort to tie to any infrastructure program the need to address these basic needs of having adequate quality water. We need to have an infrastructure program that improves the roads and improves the bridges and improves water conveyance in general, but we have to first address these very glaring small water systems. They're not at all appealable to many of the people who are lobbying for investments in this area, but they're vital to the people who are on those systems.
Well, thank you for that. That's, again, we could spend a whole day on this. Just a couple of things I would add. We have got to connect these issues to health outcomes, reproductive justice outcomes. So we in the public health community, I myself have been guilty of this, can start talking and immediately put people to sleep because we just don't talk. We talk to everybody like they're in public health. And so we have got to start talking, I mentioned this before, in a way that people actually hear us and can act on it. So let's take a page out of marketing and come up with the kind of language and messaging and imagery we need to make this case. Here's how water actually impacts our health. Everybody thinks they know, but until we sell it to them, we can't necessarily get people to act. Storytelling is hugely important. But from a funding perspective, because we also grant funds, innovation, you talked about entrepreneurship is everybody talks about that. But innovation means different things. And so I think it was Tynesha McHarris from Novo a few weeks ago said, we just need to give people we believe in you money. Because we fund and we ask for all these measures, and frankly, the issues that we're talking about can't be measured yearly. And a lot of community groups have great ideas. I mean, if you talk to people, they know what the issues are, they have ideas about solutions, but they can't happen annually. So wouldn't it be great if we could just fund people because we believe in you and not put a great burden on them to measure impact and outcomes, but just give people some time to see what actually happens. And then to encourage groups to work with non-traditional partners. You mentioned partners, the teachers union. I mean, teachers see what's happening with kids in their classrooms. Other associations, there are plenty of organizations out there that we typically don't partner with that could actually help get the message out and inform people in the way they need to be informed to get the kind of change at the policy level that we need to see.
Yeah, I want to piggyback on that, in that just making the point that the changes that we want to see are going to take, a long time, right? So they won't be measured next year, or even 10 years or 20 years. So the California Endowment right now, we have an initiative called Building Healthy Communities. Some of you may know about this. It's a 10-year initiative. It's $1 billion that is invested in 14 different sites. And we're based in, my base is in Long Beach, and we constantly have these discussions like, these are the changes that we want to see in our community, but how is it that we're going to be able to show that this change is happening? And we came up with the answer that actually we're not going to be able to show that. The things that we can show actually are the increase in people power, right? We can show the kinds of relationship building. We can show the types of ways that strategic partnership is happening. We can show the way that we are shifting the narrative around towards prevention and towards equity. But in terms of things like, can we show a decrease in asthma rates over 10 years? I don't think so, because obviously these issues are so large. So I really want to appreciate that point. And I think just in terms of the strategic partnership, I mean, that is so key, and it's really going to take everyone to think about what is your contribution to that, right? What is the critical question that you bring? The kind of centering on community community at the center of this, that really thinking about water systems. I think your point is really well taken in that, if it's not community at the center, then we might get these crazy, top-down proposals around water funding and so forth. So again, that's why we need to be at the center. And I think just from a funding perspective, I mean, Michele, maybe you would agree with this, that that strategic partnerships, that's going to get that would be something that funders would actually really be very supportive of. And so this can all work.
I was actually in the water meeting earlier, and one of the things that's really struck me in the last 4 years that I've covered policy and water for our office has been the issue of diversity within the field. I had the same experience the first time I walked into MWD, which is the Metropolitan Water District, for a meeting. I was probably one of the few women, let alone even more so, one of the few women of color who work in water policy. Being a member of a First Nations tribe as well has also been very interesting within the last couple of months with the development of Standing Rock and other issues that we've seen even within our state. Senator Hernandez actually recently went up to, I believe, the Salinas Valley area, and he met with people who are directly affected by the lack of access to clean water within our own state. And we always think about, that's in a different area, not in Los Angeles, but it happens in our own backyard. And the important thing is to get people who have direct knowledge to become not only educated, but to become advocates, to become members of water boards, to become members of group coalitions, to advocate on your behalf. One of the other things that was also interesting was somebody mentioned wicked problems. That's one of my favorite things to talk about, because when we think about data, if we're addressing issues from data from 2010, we're already behind indefinitely, because by the time we start addressing the issues that happened in 2010, now we're going to be way behind with the issues that are currently ongoing that definitely need to be addressed. So accountability and transparency is of the utmost importance right now in water.
So I come from the Great Lakes state, and we like to take water in some ways for granted, but of course we've had Flint. And we also had another really interesting experience with Toledo, so our neighbor just to the south in Ohio. So at our School of Public Health, I was involved in bringing the director of communication, who's a woman, from Toledo to come and talk about when she got the text on her phone at 4 in the morning or whatever the time was that said, you can no longer drink the water because we've had a harmful algal bloom that has made its way to the intake of our entire city's water intake. And that was because of a storm. So with climate change, we'll have increased storminess. And these sort of weird events are going to start happening. And they had no plan. And in 4 hours, there was no water to drink within a 75-mile radius. And nobody was in charge because they didn't have a plan. So one of the things that you might do if you're in an institution of caregiving is ask your local hospital. So what would happen to us if our water system went down? And if you don't have a good plan, maybe we could do a low stakes planning exercise. Funders could help. Elected officials might want to convene this. We can talk about it, bring together unusual partners, and get this figured out so that we don't get that text and go, we have a plan, and we have a plan that will help the vulnerable communities and all of us so that we know what to do. And so there's such a great opportunity in public health to not always have the solutions, but to have the question, what would we do? And then we know a procedure by which we can start to bring together the groups and the voices and the experts to get that going. So my challenge to you is, go ask those really important, difficult questions that public health is so good at doing, and ask it about water, and ask it about air, and ask it about the state of the climate.
Great. Oh, there's so much to talk about here. It's hard to know where to focus. But I also got to be part of the water workshop, and I think what I'd like to convey here is that while quality drinking water is first and foremost in the minds of, I think, the public health community for obvious reasons, and so much of the state, as Angelica just mentioned, doesn't have that kind of access, that is first and foremost, yet there are also tremendous other benefits that can come and will come if we do water infrastructure and modernization in the right way. We can build gray infrastructure or we can build green infrastructure. And I want to encourage everyone here to go take a look at the website of Pacoima Beautiful, one of our panelists in the water workshop, which over the last 5-7 years has had a very strong community engagement process to develop an urban green vision plan. And they're at work at it right now with a multi-stakeholder partnership, including the DWP and private foundations and others. But essentially, the benefits that the community will experience include new park and open space, the ability to connect from a public housing project to a local high school with a beautiful pedestrian and bike path that the community has never had before. There's tremendous job potential, everything from manual laborers and gardeners all the way to sanitation engineers. And so we know that there will be major water funding coming to Los Angeles, both through state bonds and also potentially through a water infrastructure bond at the county level. And also, as Angelo mentioned, the federal infrastructure, we need to pay attention to that as well. But I just want to kind of lift up for all of us that it's not only the drinking water quality, but the other kinds of quality of life benefits that can really come about from water. Finally, just on the funding note, since that's what Liberty Hill is, to bounce off of Linda's point around funding the people you believe in. I think, I've been in this field for 30 years now, and at the end of the day, that is a big part of it, being able to have trusting relationships with grantees and with partners to be able to really take on these tough problems. And we continue to be an advocate for core funding, flexible funding, and multi-year funding, so that it's not just the treadmill that of annual grant reports and proposals and so forth.
Okay, so being a former organizer, I still think I'm always an organizer. I want to leave you with a useful tool because I'm really concerned that many of you don't know where your water comes from. So if you pull out a pen, I want to give you a link so you can find out who your representative from every level, from congressional to who manages your water or the entity, your community college rep, your city rep, who manages your transportation as well. Are you ready? Or you can also just pull out your phone and text it in. So it's really simple, rrcc.lacounty.gov. You put in your address, and it'll pull out who your representatives are. And so hopefully, I think, given what everyone shared, you know, that's a first step you can take to see who your representative is and then see when they meet. You don't even have to go to their meeting. They do a lot of live streaming of their meeting and see what's on their agenda. Might be rate increase, might be other issues. So I really encourage you to do that next step to get more educated about water and water rights and water process. Thank you.
Thank you. So Michele and I worked a lot together, and we both went to the water workshop because we recognize that even within the environmental justice community and in those of us who work sort of at the intersection of environmental health and justice lacked real knowledge, depth of knowledge around issues related to water, right? Because we're urban, right? We forget that LA is a desert, all of these things, right? So this idea of education and partnerships with public health communities around understanding the health, waterborne disease, the health impacts of water. I know, in the soil workshop, we talked about, we were doing soil work in Jordan Downs, and we ended up having to do water work, right, and air work. So all of those issues are incredibly interconnected. And so the basis for these partnerships are there, and I think that we want this, again, to be a place where you network, you talk to us, we start building those relationships that actually can move work. When we first started this 8 years ago, From here, we ended up doing a lot of green cleaning trainings. That led to a lot of us having a conversation about the need to actually disclose the chemicals. And, we just had a bill from Senator Lara's office. So ideas can be born here if we care and nurture them with the relationships that we continue to have beyond today, because there's lots of issues, right? We need to bring more funders to the table. We need to better understand water issues. We need to really figure out what upstream solutions are, all of those things. So I'm going to stop there. Do we have time? Or what do you want? Q&A? All right, so I'm going to stop talking because I do really want you to engage and ask us questions. We hope we can answer them. So I'm going to open up the floor to first questions, so please formulate a question. If we have time, we'll also open it up to comments. The mics are up here, actually.
Oh, can we understand?
Material del plástico, de la botellita de agua.
O de las botellitas de agua que
Porque he oído como cosas.
Si puede usar el micrófono, por favor, porque no le.
O que si hablan del material donde está la botellita de agua, porque he
If you
oído
can speak
cosas.
about the material from which the water bottles are made of.
No, bueno, okay. Ustedes que son expertas.
I'm going to do it in English and then I'll do it in Spanish for you a little bit. Yes, so a lot of the companies that produce the water bottles do use recyclable and renewable materials. However, we do understand that many people don't recycle them and throw them to the trash. They end up in landfills that then go into our air, etc. But I think one of the important things to point out is that a lot of not only organizations on the nonprofit section, but the public sector as well as the private sector have done campaigns in the past to encourage people to further recycle so that we don't have all of these items affecting our overall climate. Hizo la pregunta sobre las botellitas del agua y me parece que su pregunta era de qué está pasando con las botellas. Ajá, ¿de dónde vienen, verdad? Ok, sí, la mayoría de las compañías que producen las botellas de agua lo producen de material reciclado. No todas, pero la gran mayoría sí viene de producto reciclado. Igualmente, muchas compañías han hecho promociones explicándole al público general que es importante volver a reciclar la botella en vez de tirarla al basurero. Nosotros sabemos que cuando cosas así van al basurero, van a ir a donde llevan lo demás de la basura y eventualmente eso es destruido, va no solo al piso, al aire, al agua, etcétera. Entonces sí sabemos que necesitamos hacer un mejor trabajo en quitando este producto no sostenible de las botellas.
And the other solution is to stop using bottled water. And there's other plastics that are in water. So straws, most useless product, plastic straws, one of the most useless products on the planet. It also breaks down and ends up in the water system. The other thing that we don't think of is body scrubs. A lot of body scrubs. So when you go get your pedicure and they do your scrub, if it's not a natural scrub, there's also plastic microbeads in there. So there's a tendency for us to overuse plastic in a lot of settings, and a lot of them end up in the water system. So stop using straws. Like that's the one thing we can tell them not to give them to you. Maybe they could stop producing them, but it's an unnecessary. How hard is it, right? How hard is it? And it's really wasteful. Sorry. All right, one more question, and then if folks need to leave, you're free to leave. If you want to stay for more conversation, we invite you and encourage you to do so. Another question, comment? No? Oh.
All right, well, it is 1:30, so I am going to say thank you to everyone who's attended. Please fill out your evaluations. We hope to see you next year. And as a final thing, let's please thank all of our panelists and moderators. And feel free to approach the panel if you have other questions or comments.